Right. All right. Good afternoon. It's me again, Alexander, your moderator from Embry-Riddle, Aeronautical University, Embry-Riddle Worldwide, College of Arts and Sciences. So please don't go away, but you have to make do with me this afternoon because we are still going to see, to have the presentation on unpacking officers of violence prevention effectiveness by our colleagues Rachel of the University of San Diego in the United States and then Alfredo from Peace in Our Cities, but they're unable to make it. They're also unable to make it synchronously online, but what they were kind enough to do is record the video. So what we are going to do is we are going to watch together. If you decide to stay, which I would hope, we are going to watch the video together and use it as an incentive for us to discuss a little bit. And then apparently, if you have questions, I would like to get in touch with the two presenters. We would be more than happy to facilitate correspondence to follow up. So if that works for you, gentlemen, thank you so much for your assistance. And then let's get started with the video. And then after that, we'll have a conversation. Thank you.
Good morning, good afternoon. Thank you for taking the time to listen to our presentation. My name is Alfredo Malaret. I am the Urban Violence Program Officer at the University of San Diego and one of the co-facilitators of the Peace in Our Cities network. Briefly, Peace in Our Cities is a network of 23 cities and over 30 community partners working together to halve urban violence by 2030. I am joined here with my research partner, Hernan Flom, and I'll pass over the mic for his introduction.
Thank you, Alfredo. Yes, my name is Hernan Flom. I'm a political scientist, a professor at Trinity College in Hartford, Connecticut, and a consultant on violence and crime prevention for Peace in Our Cities and other organizations. So before we start, I wanted to give you a sense of what the purpose is of this project, which is to understand what is it that makes offices of violence prevention or OVPs effective, to know what elements to watch out for in setting up an OVPs. This is the criteria that we'll be going over with you shortly, and thus to provide informed advice to Peace in Our City members who are either thinking about setting up an OVP or who want to maybe enhance the offices that they already have. So now Alfredo will share some methodological considerations of how we proceeded with this study.
Thank you, Hernan. And before we jump into the criteria, as you mentioned, I'll just share quickly where we are in the research. We conducted landscape analysis, and we started with a universe of cities, and we selected a universe into 4 buckets. We first put the first bucket at 50 most dangerous cities in terms of homicides, according to Seguridad, Justicia, Paz, an NGO that does this work every year based in Mexico. Then we put that same ranking for the last 5 years in the second bucket. Then Peace in Our Cities, member cities in the third bucket to see what's the landscape in those cities. And the fourth bucket of noteworthy or seminal cases that kept coming up in the literature review and in the examples. From that landscape analysis, we identified 84 civilian-led OVPs, out of which we selected a subsample of 18. The subsample selection was based on strong civilian leadership, a measure of stability, and then availability of public information. Right now, Hernan and myself are deep into the analysis of these 18 OVPs, and we'll share initial insights and initial observations from the criteria that we're using to analyze this subsample. So over to you, Hernan.
Okay, thank you, Alfredo. So the first criteria that we identify is a clear public mandate. So could you tell us, what are we looking for with a clear public mandate, and if there are any examples from the analyzed cities that stand out?
Yes, absolutely. A clear public mandate is foundational to their effectiveness because it should outline strategic priorities and the scope and the vision of the office and be public. People who these officers serve should have access to this documentation. It should also identify the principles that would underpin the decision-making process and the violence prevention approach. One standout effort is the Chicago Office of Violence Prevention, established by the Department of Public Health in 1994, following the Surgeon General Declaration of Violence as a public health epidemic. I think this is a standout case because the strategy leans heavily in primary prevention, and that comes clearly in their work. They do prevention by increasing awareness, by identifying alternatives to resolving conflicts, by surrounding children with protection, building a community strength, and supporting partners, parents, and caregivers. There is some secondary prevention in their work, but it is a strong office that is focused on primary prevention through a public health lens. So that's a very clear public mandate.
Yeah, so our second criteria has to do with the community that OVPs serve and the consultation that they establish. So why are consultations and community partnerships so important? And again, does any OVP stand out for the type of associations that they have with the community in designing and implementing programs?
Absolutely, yes. Relations and partnership with community partners, it's absolutely fundamental for success and their stability. They provide buy-in from the community, they provide stability, they provide responsiveness to evolving contexts because the communities lived in there. They inform the accuracy of the diagnosis and they build trust with populations that they serve, often populations that have been marginalized by authorities or have distrust in law enforcement. One standout case is REACH in Edmonton, Canada. This is probably one of the strongest examples of this. Everything they do, every initiative, every project is in consultation with community, is co-designed, is co-implemented with community partners. In an interview, the director mentioned that they have over 150 partnerships. And they also, in their initial formation, in their diagnosis, they conducted over 1,000 interviews with local residents to inform their priorities and what should their work focus on. So it comes strongly as one of the best practices that we have seen so far.
Thank you. So our core criteria is related to what we're talking about, which is that the existence of diagnoses or baseline assessments. And again, why are these important? What are we looking for in a diagnosis? Should these be updated regularly? And again, do you have any standard practices that you would like to share?
Absolutely. Yeah. I mean, a sound diagnosis or a baseline assessment, it's the basis for a correct prescription and a correct intervention. They inform the efforts, they should inform the efforts, and they help minimize negative unintended outcomes from any intervention. So yes, and do best practices do update this regularly because as we all know, violence evolves and changes, and so do the populations that live in a city. So this should be changing with it. One good example is COPREF in Chihuahua, Mexico, Council for Violence and Crime Prevention in the municipality of Chihuahua. I think this is a standout example because they have 2 lines of diagnosis, one a comprehensive diagnosis of the full picture of the city, and they also develop specific diagnosis for particular interventions that they're going to carry out or plan to carry out. So they having these parallel lines of diagnosis also seems to be a good practice. I think they also do interesting reporting practices by releasing their impacting videos, end-of-year videos that are accessible to a wide population. So I think that's a interesting practice.
Excellent. So precisely in terms of population, this is our next criteria. What is the target population of the interventions or programs of the OVP, and how are they defined, and what is the criteria for selecting them? What have you noticed? Why is this important, and what have you noticed in this area?
It is absolutely important in order to focus the efforts and to maximize their impact. There is high variation across the OVPs, but they do, one of the key takeaways is to have actually clear criteria to define the target population and who are you serving, and is that needs to be served. They feed from the diagnosis, they tend to feed from the diagnosis, so it's a positive observation. And the main criteria that we have seen so far is vulnerable populations or populations under chronic vulnerability. And these are compounding vulnerabilities that affect their daily life. So that's a positive observation that we have seen. In terms of what types of population they actually serve, as I mentioned, there is actually wide variation. In Palmira and in Cali, in Colombia, they focus heavily on prevention of at-risk youth. REACH in Edmonton has focused on communities that are overrepresented in the justice system and increasingly changed their focus to recent migrants because of their vulnerabilities. And that is also a good example of how a diagnosis has evolved over time by being partners with the community and listening to the on-the-ground realities. Oakland in California has different programs that serve different populations at risk. One, for example, of their program serves people who are vulnerable to gender-based violence or to commercial and labor exploitation. So that's another example of very targeted interventions that focus very specific populations following from a diagnosis.
Is there a challenge in terms of defining the population?
Absolutely. Find the right balance between being ambitious enough and not so ambitious that it gets diffused and it doesn't end up serving those who need it the most.
So now we come to a fifth criteria, which is key to an Office of Violence Prevention, which is precisely its prevention approach. So what are the main types of approaches that you're seeing, that you're picking up in these offices in terms of the classical distinction between primary, secondary, and tertiary prevention?
Yeah, I mean, this is a pattern that is emerging, but it is very clear that most of the offices of violence prevention do focus on a primary approach to prevention. That might be a reflection of the subsample selection, that we did focus on those who have a clear prevention mandate. After that, there is also almost a natural evolution that many do focus also on secondary prevention, and less so, but a growing number in tertiary prevention. One example of one that is focusing on tertiary prevention is Medellin, and that's an interesting case because it is a post-conflict scenario where they do have experience in reintegration of combatants and how that affects urban violence. So that's an interesting case. But in general, the emerging trend is most focused on primary, followed by secondary, the most common, and fewer on tertiary, but a growing strength.
So now we come to some of the key factors that make an Office of Violence Prevention work. The first one of them being budget sustainability. So how are usually these offices financed? And again, is there any case that stands out among the sample?
Absolutely. In general, mayor's budgets and/or the city or municipal council tend to fund these offices. Here, there's another emerging trend, and it's a big split between the global north and the global south. The global north tending to have bigger, stronger, more predictable budgets, and the global south tend to have smaller budgets and therefore having to apply for international cooperation, international assistance from the multilateral system. This has the effect that what we see in the global south is that they have not the ability to plan in 5 years, but rather projects or plans or programs that have a shorter lifespan because they are contingent on donor funding that is usually bound to a year, for example. Mm-hmm. One other effect of that is that those who have more stable funding and more predictable 5-year funding plans and funding projections are able to work with their community partners and issue grants and give money to their community partners to do work when they are better situated to do this work. Again, a standout practice is the Oakland OVP and how they have community buy-in to the work they do. They have different measures that are approved by the city council and others that go to taxpayers directly to the ballot box. And that shows a level of involvement from the community they serve that it's absolutely a standout practice.
So the second of these key factors is the staff that makes up the OVP. And in this sense, what kinds of staff composition are we seeing? Is it staff that is specialized in multiple disciplines?
Again, an emerging trend that we are seeing is, yes, a specialization of staff when they have the funding to have very set programs. When they have community gun violence interrupters, they hire that kind of stuff, the gender-based violence programs. So there is one of the trends that we're observing is a tendency towards specialization. On the other hand, we also have OVPs that have communicated that they actually prefer to hire generalists. Mm-hmm. And that is due to a context that is consistently evolving, so they have to be very adaptable to different violence approaches, or because their funding is short, and when the project ends, that staff now needs to transition to a different kind of project. So these are two trends that we're seeing coming strongly. It is too early to say that those are directly related to the funding stability, but it's a possibility that mm-hmm. we are analyzing on what their staffing composition is. One good practice that we have observed is when the OVPs actually provide training and capacity building for their own staff. And mm-hmm. if they can do that, that's always a good development marker.
Perfect. So the third factor of that allows an OVP to sustain itself, in addition to, as we mentioned, budget and staff, is additional political support or buy-in from either the mayor or the city council. So what are you seeing in terms of the type of buy-in that these officials have with their respective OVPs?
Yes, I think most OVPs that we have spoken communicate this strongly, that support from their mayor is to a certain degree important. It helps them navigate difficult situations inside the city. It helps them communicate impact. It helps by buying from the community because they do have a loud ability to speak to the city as a whole. So support from the mayor, it's key. It also helps them, and we have been told this in a confidential conversations, that when there's a very difficult situation to manage, which is part of their work, having the mayor support is important and makes them effective, makes them work. One of the trade-offs of being too closely aligned with the mayor is that mayors are part of a political administration that changes or can change. And it is important to not only put your political support or find your political support in a mayor's office, because that will change most likely. So that's why it's a consideration to make a conscious effort to have support from the city council or the different political mechanisms inside a city, civil society partners, and that's something we spoke to at the very beginning, to have those partnerships with civil society that in cases of political transition, the work can continue. There's also the difference between the office and the strategy. Having a good, sound strategy can be a marker of continuity and help give continuity to the work despite the support from the mayor. But if you can get support from the mayor, absolutely, it also helps you communicate the impact.
Yeah, I mean, as you said, it's very important to have the support without falling into a trap of too much personalism and the office being completely dependent on the mayor not surviving hence a political change. So finally, and going back to what you were saying in terms of results and impact and their communication, so what are we seeing in terms of the impact evaluations in OVPs? Is this something that they are producing? And why would you consider this to be important?
Yeah, so impact evaluations are absolutely important to want to measure the impact, to know if they're having a positive impact or if they have unintended consequences, or almost from a fundamental perspective of a policy intervention. But also from getting political buy-in or community buy-in to show why you're paying for this office, to show the effect that this is having on current urban balance dynamics. One of the best practices is, again, Reach in Edmonton, which presents almost a yearly, I think, impact evaluation with results. And that has helped them have the support they need, defend their different funding mechanisms. In the absence of a comprehensive impact evaluation, we have also seen project or program evaluations. In Pelotas in Brazil, the Pact for Peace also has a project evaluation that has found that they have a positive impact. The same goes for Palmira in Colombia. They have a project evaluation that has shown how their strategy has had a positive impact in improving security. So they're good for a policy perspective, they're good from a communications perspective, and they're good for showing you value. It is not only important to have those impact evaluations, it is also important to know how to communicate the impact. So that's the second part of having them, that those who can do it the best are best positioned to have a stable run.
Thank you so much, Alfredo, for laying that out so clearly. So with that, I mean, we've given you the criteria that we are working with to evaluate the performance of OVPs and what makes them effective. So our next steps are to bring these criteria to different cities and imagine what the implementation and the adaptation of an Office of Violence Prevention would look like in their particular case. As I said, what should they watch out for? What should they consider? And how should they adapt to their specific situation? And we will include that as well as a systematic analysis of these criteria and various success stories and lessons in each one of these in the final report, which we will publish and share with you when it is completed. Obviously, you can contact myself or Alfredo, and if you have any closing thoughts or remarks.
Thank you, Hernan, and thank you very much for taking the time to listen to us. My email is open, and please feel free to reach out to us, and we'll be sure to distribute the final report once that's published. Thank you, everyone.
Thanks, everybody.